Dr. Collier.
Good morning, Rickey Smiley.
Hey, man, love you, man. Thank you for everything you do, Dr. Collier. All this stuff with coronavirus, these numbers are spiking. Are the Thanksgiving numbers going to spike this week?
Yeah, unfortunately they are, Rickey, and we expect that to be. And by the time they get to 2 weeks from now, we're going to get into the Christmas issue, and I'm hoping that information will really alter some behaviors of people, because that is really the reason that we're having a big spike. It was just a super spread event. We still got over 100,000 Americans in the hospital with COVID, and at this point now the hospitals are strained not only from the physical facility, in other words, there's not enough beds, but even if people get in the hospital, they don't have enough staff. You got, some people have been working nonstop for 9 months, not a day off, and it's just getting to them. Everybody's just human, and even if you had to be on a ventilator, we don't have enough respiratory therapists.
Wow.
So this is really a problem now, because, the physical realities of the ability to provide healthcare services are being challenged, and we just have not had that in the United States. So some good news, though, Rickey, that with so many people pushing, including the Rickey Smiley Morning Show, when people get their flu shots, many people have responded with enthusiasm. So this, along with working from home, use of masks, social distancing, and fewer social gatherings due to the corona, have decreased the number of flu cases. So the number of cases reported now is the lowest that we've had in 9 years at this time of year. So that is showing the impact of, following the guidelines, washing your hands, wearing your mask, etc. Because, if we start to have this real twin-demic, i.e. people having coronavirus and the flu, it's just going to overwhelm the healthcare system. I think at that point, a lot of these non-believers will become believers. So we're not plateauing. We're still on a critical upward trend. The numbers are expected to grow further, particularly next week, because that'll be 2 weeks following Thanksgiving. So toward the latter portion of this week is really when we're going to have some problems. Now, we also got the CDC has come up with a new universal mask use recommendation. That means you wear a mask basically anytime you up and breathing, except in your own home, unless someone in your home has been exposed or has tested positive, then you even need to wear a mask there. But they feel that this is going to provide protection for the person wearing the mask, as well as the people that are around that person, because we've entered a high-level transmission area in the United States. Mask usage is critical, and in indoor and outdoor spaces. So we, talked before about if you're outside and you can social distance, you don't need to wear a mask. Now, compelling evidence supports the benefit of cloth face masks for both source control, to protect the others, and to lessen extent protection of the wearer. So, supporting President Biden's 100-day mask wearing initiative is going to be big, but you don't have to wait till he's installed in January. We can start now. Day one can be today. Start wearing your mask, social distance, and wash your hands. Remember to boost your immune system as well. Vitamin D, omega-3 fish oil, zinc. Those are the things that you can do.
Hey, Dr. Collier, and tell people, real quick, Dr. Collier, that if you start treat the symptoms. Don't just wait on the hospital or the doctor to prescribe something. Whatever you feel, treat the symptoms. Is that correct?
That's absolutely correct. Start immediately. You don't want mucus to build up in your chest,
yes,
because that predisposes you to a secondary pneumonia. That's where these long timers are coming in and having extended problems. So Mucinex DM maximum strength, a non-sedating antihistamine, Allegra, Zyrtec, Claritin, etc., and then a cough syrup such as Tussin or Delsum if you need something to control your cough, and anti-inflammatory. They keep talking about the benefits of anti-inflammatories and how much difference they make. So that's Motrin, Advil, Aleve. Get all those things. Have them at your house so you're ready. At the first sign of symptom, even if it's just a cold, even if it's the flu, start taking and treating yourself. Don't wait until you're 3 or 4 days in and the disease process has really started to manifest itself. You can help mitigate those symptoms. You can help shut it off. Just start taking those, treating the symptoms.
Hey, Dr. Collier, if you have COVID or whatever, make sure you wear a mask. He already did the disclaimer. Make sure you wear a mask and also put on a pamper, because it comes through the flatulence as well. So you have on a mask and a pamper and keep the people around you safe. Love you, Dr. Collier.
These are the opinions of Dr. MJ Collier, not those of the Rickey Smiley Morning Show or its radio affiliates. Okay, Rickey. Wear a pamper, or it depends.